practitioner today to do your physical exam. What's your name?
Michael.
And what would you like to be called?
Mike.
Mike. Okay, great. So I'll give you specific instructions as we go through your physical exam from head to toe. All right? So let me just wash my hands really quick. All right. And then patient is well-developed, well-nourished, and well-groomed, dressed appropriately for the weather, and is in no signs of acute distress or pain. All right, so we're going to start by looking at your arms, and I'm just going to feel them really quick for your temperature. Good. All right, can I look at your nails here? What about this one? Okay, I'm going to feel your wrist. Thank you. Your right hand. Can you relax for me? Thank you. Okay, go ahead and relax. I'm going to feel your shoulder right now, kind of like massaging, and tell me if there's any pain or tenderness.
Nope.
Okay, let's do this side. How about that?
No pain.
Okay, good. Next we're going to do some range of motion exercises. Just kind of follow what I do, okay? Raise your arms all the way up. Great. Extend them all the way back. Good. Now raise them to the side like this. Perfect. And bring them across your body like this. And now I want you to make 90 degrees and flip them up. Okay. And now you can relax. And I want you to take one of your arms and reach across your opposite shoulder. Good. And do the other side. Perfect. Next, I'm going to put my hands right here, and you're going to try to push your arms out while I try to push them in. Okay? Perfect. And just do the opposite way. You try to push in. Good. All right. Next, we're going to move on to your elbows and look at that. Any pain or tenderness as I massage and feel?
No.
Okay, let's do this. How about now?
Nope.
Okay. So same thing. Let's do some exercises with your elbows. So if you can extend your elbows out, bend them, extend them a little bit. Perfect. Now what I want you to do is I'm going to try to push away, and you're going to try to pull in. Good. Nice and strong. We'll do the opposite. Perfect. And then next I want you to just extend your palms out and then flip them down. Great. All right. I'm going to look at your wrist here. You can relax that one. Any pain or tenderness?
Nope.
Okay. Let's check this one. How about now?
Nope.
Okay, let's do some wrist exercises. So hold them like this, flip your palms down, flip them up. Can you make a tight fist for me? And what I want you to do is I'm going to try to push your wrist down, and you're going to try to resist. And do the other way. Good. All right. Next, what I want you to do is hold your wrists out like this and rotate them out, then rotate them in. And then put the back of your palms together like this. We're going to hold this for 60 seconds, and your job is to tell me if there's any pain or tenderness or something out of the ordinary. In theory, I would do this for 60 seconds to check for carpal tunnel syndrome. All right, great. Next, I'm going to check all your fingers. So I'm going to feel each one. And you tell me if anything's out of the ordinary, anything hurts.
Nope.
Okay, let's check this one.
Nope.
Okay, that's your last one. Perfect. Let's do some finger exercises. Make a fist, extend them out, close your fingers, spread them out. Okay, your job is to keep them spread apart as I try to close. Okay, perfect. Now what I want you to do is grip my hands nice and tight. Good, nice and strong. All right, next I want you to use your index finger and touch your nose really fast. Perfect, and let's do it with your other finger. Okay, good. All right, so next what I want you to do is hold your palms out like this, and I'm going to have you close your eyes, and your job is to keep your arms straight and up, okay? Okay, perfect. Go ahead and relax. Next, we're going to move on to your head, okay? So I'm going to look and feel. And look at your hair. You have a full, thick head of hair. All right, I'm going to feel right here. Perfect. Now I'm going to look at your eyes and your eyebrows. and your sclera, which is the white part of your eye, your glands, and your eyelashes. And I'm going to look at your conjunctiva, which is this pink part, and I'm going to pull your eyelids down and you're going to look to the ceiling. Good. Alright, next we're going to do some face exercises, basically. Can you raise your eyebrows? Perfect. Frown. Smile. Close your eyes nice and shut. Good. Puff out your cheeks. And then clench your teeth. Good. And open your mouth. Perfect. Cranial nerves 5 and 7. Next, we're going to do a sensation test. So I'm going to use this cotton ball, and I'm going to touch each part of your face, and your job is to close your eyes and tell me where you feel it, okay? Right cheek, nose, forehead, or something like that, okay? All right, here we go.
Left cheek, nose, forehead, chin, right cheek.
Perfect. Now open your eyes. Cranial nerve 5. Next, I'm going to put my hand on your cheek, and I just want you to turn against my hand, okay? Perfect. One more time. Okay. Next, I'm going to put my hand on top of your shoulder, and I just want you to shrug against my resistance. Perfect. Cranial nerve 11. Alright, so next we're going to move on to your eyes, and I'm going to flash a light inside just to see your pupils, and I just want you to look straight ahead at the wall, okay? So 2 times bright light. There we go. Okay, and then do your other eye. Look straight. Perfect. Cranial nerves 2 and 3, pupils parallel, equal, rounded, reactive to light, and accommodates. Alright, next what I want you to do is I'm going to use this flashlight, and your job is to follow it with your eyes, but don't move your head, okay? Here we go. Good, nice and slow. Perfect. Good. Great, now keep looking at it as it comes in towards you. Perfect. Cranial nerves 3, 4, and 6. Alright, next what I want to do is test your peripheral vision. So what I'm going to do is kind of wiggle fingers, and your job is to tell me when you first see my fingers come into your sight, okay? Here we go.
Yeah. Yeah. Yeah.
Perfect. Alright, and the next thing we're going to do is, that was cranial nerve 2. The next thing we're going to do is look at your eyes with this kind of a light, but for this exam we have to dim the lights, okay? So in theory I would dim the lights for 5 minutes before performing this exam. But in this video we're not going to dim the lights. Okay, so what I want you to do is look straight ahead, and I'm just going to use this light and look into your eyes, okay? Okay, perfect. We're going to do the other side now. Perfect. Alright, you can just relax there. Good. Cranial nerve 2, disc margins sharp. Alright, next we're going to move on to your ears, okay? So I'm just going to take a look at them and feel. And you tell me if there's anything that's bothering you or hurting. How about that?
Feel good.
Okay, good. Alright, next we're going to do like a hearing test. I'm going to cover one of your ears, and I'm going to whisper some numbers and just repeat them back to me, okay?
Okay. 1, 2, 5.
Okay.
6, 9, 10.
Perfect. Alright, cranial nerve 8. Okay, the next thing we're going to do is look inside your ear. Grab my equipment. Alright. Perfect. So you're going to gonna feel me kind of open up your ear by kind of pulling up on them, okay? Okay, perfect. And do your other side. Okay, perfect. Tympanic membranes pearly gray, bilaterally conolite visualized, crisp landmark, and ear canal patent with scant amount of cerumen. Alright, next what we're going to do is use this thing called a tuning fork. I'm going to place it on top of your head, and your job is to tell me kind of where is the sound kind of distributed. Is it equal, or is it more on one side than the other?
Equal.
Okay. Now we're going to do the same thing, but I'm going to put it behind your ears, and your job is to tell me when you stop hearing it, okay?
Okay. No.
Okay. Do you hear anything right now?
Mm-hmm.
Perfect. Same thing on the other side.
No.
Okay. You hear it now?
Mm-hmm.
Perfect. Alright. Next we're going to move on to your nose. Okay, so I'm going to look at it and feel. Your nose is midline. And what I want you to do is close one of your nostrils with your finger and breathe in. Let's do the same thing on the other side. Perfect. Alright, and next I'm going to look at your nose with this light. Just relax, and I want you to just kind of tilt your head back a little bit, okay? Okay, let's do the other side. Okay, perfect. Alright, next I'm going to kind of press on your face. Just tell me if there's anything that's tender. About that.
No.
Perfect. Alright, next we're going to move on to your mouth. So I'm going to look at your lips and your tongue and your teeth. Can you smile? Great. And can you stick your tongue out for me and move it to the right and then left and then touch the roof of your mouth? Perfect. Cranial nerve 12. Next, what I want you to do is you're going to open your mouth. I'm going to look inside your throat, and then when I say ah for me, okay? Say ah. Perfect. You can stop. Uvula rises and falls with phonation. Alright, next what I want you to do is kind of just swallow so I can just watch. Perfect. And in theory I would do the gag reflex, but we're excluding that for this exam. Cranial nerves 9 and 10. Alright, next we're going to move on to your neck. I'm going to feel and look. Okay. I'm going to feel right here. This is called your trachea. It's basically like your breathing tube. Okay, anything hurting?
Mm-mm.
Okay. Next what I want you to do is some exercises with your neck. So can you bring your chin down to your chest? Extend it all the way back like this, like you're looking up. Good. Now I want you to put your ear to your shoulder like this, and the other way. Okay. And then rotate your head to the right, like turning, and then turn to the left. Good. And next what I want you to do is turn against my hand. And again. Perfect. Alright, next what we have to do is kind of feel for your thyroid is what I want to do. And what that entails is you taking sips of water, and when you swallow, you're going to feel me push right around your Adam's apple. And I'm just trying to feel and see how your thyroid is, okay? We're going to do that 2 times. I'll give you this. I'm going to come behind you for that. Okay. So I'm going to feel right here, and go ahead and take a swallow. Okay, good. Now we're going to do that one more time. And swallow. Perfect. Alright. to just feel around the back of your head and your neck area just to see if we've got any lymph nodes there. Occipital, anterior cervical, posterior cervical, post-auricular, pre-auricular, tonsillar. Can you open your jaw for me? And close. Perfect. Submandibular and submental. Okay, great. Next what I'm going to do is kind of look at your chest and listen to your heart and lung sounds, okay? So first I'm going to look. I'm going to feel your chest, okay? No heaves, palpitations, or thrills noted. Alright, next I'm going to feel right under your nipple right here just to feel your heartbeat. Okay, perfect. Alright, now I'm going to listen to your heart. Just breathe normally and relax. Aortic, S2 greater than S1. Pulmonic, S2 greater than S1. Erb's point, S1 equal S2. Tricuspid, S1 greater than S2. Mitral, S1 greater than S2. Just going to feel. Perfect. I'm going to listen again. Just sit up straight and breathe normally. Perfect. Now I'm going to do the same thing, but this time I just want you to lean forward for me. Okay? Lean forward a little bit with your head up. Perfect. I'm going to listen really quick. Okay, we're going to do that one more time. Okay, perfect. All done there. Alright, next we're going to look at your back area. So if you could just turn around for me. Perfect. I'm going to look at your chest, the side of your chest and your back. Alright, so next I'm going to feel your back and just let me know if there's any pain or tenderness. How's that?
Nope.
Okay, perfect. Next I'm going to put my hands right here, and all I want you to do is take a really big deep breath in and blow it out. Perfect. Respiratory expansion symmetrical within normal limits of 1 to 3 centimeters. Okay, next what I'm going to do is put my palms on your back, and each time you feel my palm on your back, just say the number 99, okay? Here we go.
99, 99, 99, 99.
Perfect. Then next what I'm going to do is tap on your back, and you'll just feel me tapping, okay? Okay, next what I want you to do is you're going to take a deep breath in, and then you're going to blow it out and hold that breath out, okay? Here we go, ready? Inhale in, and blow it out. Perfect. Breathe normal. Alright, next what I want you to do, we're going to do the opposite. You're going to hold your breath in, okay? Ready? Take a deep breath in, and blow out. Or actually, let's do that one more time. You're gonna take a deep breath in and hold it. Okay, perfect. Now Now we're going to do the same thing on the other side. And what I want you to do is to take a deep breath in and then blow it out and hold it out. Okay, now what I want you to do is breathe normal, relax, and you're going to take a deep breath in and hold it, okay? So deep breath in. Okay, perfect. Now just breathe normal. Diaphragmatic excursion symmetrical at 3 to 5 centimeters of within normal limits. Okay, next I'm going to tap on your back again, but just right here, and you just tell me if there's any pain or tenderness. How about that?
No.
Okay, let's do the other side. And that?
No.
Okay, great. Next I'm going to listen to your lung sounds on your back side. And what I want you to do is just when you feel my stethoscope like this, touching your back, just breathe in and out. Deep breaths, okay? One more time. Okay, perfect. This time we're going to do the same thing, but you can breathe normal, and you're just going to say the number 99 when you feel my stethoscope, okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, perfect. All right, next, if you could just turn around and face me again. We're going to do your reflexes, okay, before we lay you down. So we're going to do the one on your arm here first. And just relax and just look the other way from me. Position, look the other way. Perfect. I'm going to do this side now, okay? And go ahead and look the other way. Let's try one more time. Okay, sorry. Okay. Perfect. Next we're going to do the one on your elbow. So I'm going to have you look the other way. I'm going to support most of your weight here. We're going to swing your arms so it relaxes. Perfect. Let's try that one more time. Relax. Look the other way. Perfect. Good. All right. You're going to do this arm right here. If you look the other way, I'm going to bear most of the weight here. I'm going to swing your arm. Relax. Let's try that again. Good. All right. Next, we're going to do the one on your wrist. So if you could just relax on your lap there. Perfect. Look the other way. Think about something else. Okay, let's try one more time. Cool. Let's do this side now. Look the other way. Good. Relax. Deep breaths. Good. You got it. Let's do it one more time. Okay. Perfect. Now we're going to move on to your knees. So have you relax. Okay. And kind of look the other way. And just look up at the ceiling. do your other one. Perfect. Alright, next I'm going to do the one on your ankle, so if you can cross your legs, just like that. Perfect. Think about something else, move the other way. Okay? Alright. Okay, perfect. Let's try your other one here. Thank you. And look the other way. Try one more time. Okay, perfect. Now have you dangle your feet. And I'm just going to bear some weight of it, and I'm going to do something to the bottom of your feet. Just keep looking up, okay? One more time. Okay. Alright, just relax, look up. Okay. I know it tickles, huh? Alright. Okay, so next let's have you lay down. We're almost done. Alright, perfect. First I'm going to look at your neck. I'm going to inspect for jugular venous pressure. In theory, I would use the ruler to measure it at the sternal angle with the head of it at 30 degrees, and it should be within normal limits of 3 centimeters. Okay, next I'm going to feel your arteries that are right around your neck, one at a time. Let's do this one, your carotids. Perfect. Next I'm going to listen. And just stay nice and relaxed. Perfect. Alright, next we're going to look at your heart sounds again, okay? So I'm going to look at your chest and I'm going to feel. And the heaves, palpitation, or thrills noted. I'm going to feel right under your nipple again. Feel for that heartbeat. Okay, good. Alright, next I'm going to listen to your heart sounds again, alright? Aortic, S2 greater than S1. Pulmonic, S2 greater than S1. Earth's point, S1 equal S2. Tricuspid, S1 greater than S2. Mitral, S1 greater than S2. I'm going to feel your wrist here. Okay, perfect. I'm going to do that one more time, okay? is within normal limits of 6 to 12 centimeters. All right, next I'm going to feel your belly. And what I want you to just tell me if there's any pain or tenderness as I'm kind of pushing down. We're going to do light first, and then we'll go push a little harder, okay?
Good.
Okay. All right, we're going to go a little deeper. Just make some deep breaths. Relax. Any pain or tenderness?
No, we're good.
Okay, great. All right, next I'm going to just feel right here really quick here. Just kind of breathe out, relax. Okay. Aortic width is about 3 to 4 centimeters. All right, next I'm going to feel for your liver. So what I want you to do is I'm going to put my hand behind here, and I'm going to kind of push down. So take a deep breath in and exhale. Perfect. We're going to do the same thing with this side to feel for your spleen. So I'm going to reach over, breathe in, and exhale. Okay, perfect. Next, if you could lay on your right side for me, that way we can feel for your right side. Let's do it that way. Perfect. Go ahead and bring your knees to your chest. This one also. Good. Okay. All right, go ahead and breathe in and exhale. Okay, perfect. Go ahead and lay back on your back. I'm going to feel again. This time I'm going to push again. So you're going to inhale and exhale. Perfect. We're going to do one more time. Go ahead and relax your legs. Perfect. In and exhale. Okay, perfect. All right, so next we're going to move on to looking at your legs, okay? So I'm going to look at your legs and your joints and your muscles, and I'm going to feel. Perfect. I'm going to check your toes and your nails. Okay, next I'm going to feel for pulses. In theory, I would feel for femoral pulses, but I'm going to exclude that from the exam. Popliteal, posterior tibialis, dorsalis pedis. Okay, perfect. All right, next I'm going to feel your hips, okay? Like what we did with all the joints in your arms, we're going to do the same thing for your legs, okay? So I'm going to feel right here. Any pain? Any pain?
That just tickles.
And any pain?
No.
Okay, perfect. Now we're going to do some range of motions with that. Can you bring your knees to your chest? Good. Let's do this one. Perfect. Next, I'm going to bend your leg at a 90-degree angle, and I'm going to rotate your hips in like this. Good. And we're going to do the other way. Perfect. And you just tell me if anything hurts each time we do this too.
No.
Perfect. Okay, next I'm going to bring your legs across your body and back out, okay? I'm going to give you some help here. There you go. How's that? Okay.
Nope.
Let's do this one. Good?
Nope.
Okay. All right, so next I'm going to push on your thighs, and you're going to try to lift your legs up straight, okay? So just checking. Perfect. We're going to do the opposite. I'm going to put my hands underneath your hamstrings, and I'm going to try to lift your legs up, but you're going to try to push them down to the bed. There you go. Okay, perfect. All right, next I'm going to put my hands right in between your thighs, and what I want you to do is I'm going to be pushing them out, but you're going to try to squeeze your legs in, okay? There you go. Perfect. Let's do the opposite. You're going to try to push them out, and I'm squeezing them in. Go. Perfect. All right. Next, we're going to look at your knees. And what I want you to do is bend your knee up. Cool. Straighten that one out. Let's bend this one. Perfect. And go ahead and straighten that one back out. Then next, what I want you to do is bend your knees a little bit with your heels touching the bed. Perfect. I'm going to try to pull them to straighten them, but you're going to try to keep them bent, okay? And go. Perfect. Now I'm going to lift up one of your legs. I'm going to do a 90-degree here. And what it's going to happen is I'm going to try to push it down to make it bend, but you're going to resist. Perfect. Let's do it with this one. Ready, go. All right, good. All right, next let's look at your feet and your ankles. I'm going to feel anything hurt.
Nope.
Okay, let's feel your ankle here. And your toes. Anything?
Nope.
Okay, perfect. Now what I want you to do is point your feet, flex them. Okay, you're going to now point your feet against my hand. Perfect, and pull them up to your nose against me. Perfect. Next we're going to kind of rotate your ankles in. So what I want you to do is do that and go back outwards. Perfect. Let's do in and out. Awesome. All right. Okay, next what I want you to do is using the heel of your foot, run it down across your shin. Perfect. Let's do the other side. Very good. All right, next what I'm going to do is we're going to use the cotton ball again. And I'm going to lightly touch parts of your legs, and your job is to just tell me where you feel it. But close your eyes, okay? If it's your right thigh, right knee, left knee, or something, okay? So I'm going to lift up your shorts a little bit. Okay, here we go.
Left foot. Right thigh. Left knee. Left calf.
Good. All right. All right, one more thing for your feet is we're going to use the tuning fork again. I'm going to put it right on top of your big toe, and I just want you to tell me what you're feeling, okay?
Vibration.
Okay. We're going to do the same thing on this side.
Vibration.
Perfect. All right, we're all done with that part. Can you sit up on the edge of the bed again? I'm going to feel your knee. It's a little easier to do when you're sitting that way. How's that? Anything hurt? Okay.
No.
All right. So I'm going to have you stand up. And what I want you to do right now is, since we're standing, we couldn't do it laying down, I want you to just extend your leg back. One, okay, and do the other one. Perfect. All right, next what I want you to, do is turn, and I'm going to look at your back. I'm going to feel your spine. How's that?
Yeah.
Okay. Next, what I want you to do is to bend forward. Good, and bend back. Great. Now what I want you to do is bend sideways like this. Bend to the other side. Good, and rotate right with your trunk and rotate left. Perfect. All right, next what we're going to do, if you can stand right here, you're going to stand straight. I'm going to have you close your eyes. I'm going to have my arms right around you so that you don't fall. We're going to do this for 30 seconds. Just stand straight. In theory, I would be doing this for 30 seconds. Okay, great. Next what I want you to do is walking towards the wall is walk regularly so I can watch. Okay, perfect. Next what I want you to do is walk heel to toe. Almost like if you got pulled over by a cop. All right, perfect. Now what I want you to do is walk towards the wall on your tippy toes. Good, and then walk towards the window with your heels. Perfect. All right, let me just wash my hands really quick. Okay, great, we're all done. It was nice meeting you.
Nice meeting you.
Is there any questions or concerns that we didn't address during the exam?
No, I think we're
All
good.
right.